Hello, welcome back to another episode of Ask the Doctor with Dr. Jeffrey Sherman. Hello, Dr. Sherman.
How are you? Nice to see you again. Very well.
Nice to see you too. Today, we're going to be talking about how hospitals are dealing with COVID and how they've changed dealing with COVID, as it has been many months since the start of the pandemic, how they're changing their monitoring or anything else. Um, the COVID statistics for today are as follows. The CDC reports that there are 6.9 million cases in the United States, and there's 201,000 deaths from COVID-19 in the United States. Well, we recently reached that milestone of 200,000 deaths, and that's a lot. Hopefully, people will now see that stat and start to worry more about this disease, because it seems that we go through phases of dealing with the disease, forgetting about it, and then it comes back and we have to deal with it again. All right. Well, I would like to start off by asking, we've gone into detail a couple times on a couple episodes about how the hospitals are dealing with COVID-19. But now I'd like to ask, of course, how are they dealing with it now?
The protocols are still in place, but the statistics are improving. There may be a lot of positive tests out there, and the percent of positive tests over the number of total tests taken is about stable between 3 and 4%. But the hospitalization rate is less than it was, and certainly the ICU rate of the hospitalized patients is lower than what it was, and the death rate is still it is lower, but it's not as low as we'd like, of course. But part of that, so the hospitals have been dealing with it well. They kind of know through their own experiences what medicines are indicated, what works, and what doesn't, helping the patients get through it. You're still seeing the sicker patients be more seriously ill, diabetes, high blood pressure, heart valve disease, kidney trouble. Those are the ones who have a tougher time with it. The patients with not much else going on seem to do okay. And so the hospitals are a little bit better equipped, know what to expect, know about how to better treat. I think, like I said, I think the virus might be mutating a little bit to the point where the hospitalizations are coming down. It possibly is due to the virus being a little bit of a different strain or whatever, different form of it now than it was in April, where ERs were overrun with sick people.
Oh, I
Um,
see.
yeah,
The virus is mutating to the point where the tests for COVID-19 might have to be updated.
not necessarily, but the
Oh,
way that it expresses itself in its host or clinically is a little bit different. But the nature of the virus in terms of testing and its properties are still the same. But the
okay.
way it expresses itself is a little bit different. I believe that's what's going on. It's still not great, but I think it's not pushing folks to the more severe side. Part of what it is maybe just more younger people are the ones testing positive now. With colleges going back to session and
Exactly.
young people just saying hell with it, or not hell with it, but just the way they are. Those are the positive patients, and those aren't the patients who are getting to the hospital. Those folks are maybe they have a day of a stuffy nose and then they're fine. They won't even quarantine. If I'm fine, I'm going. I'll wait for my next test. I'll just do what I got to do. But my point is, it's the population that is getting affected may be different now, and the virus itself might be morphed a little bit to the point where it's expressing itself a little bit differently now, thereby changing the hospital statistics.
Okay. Okay. So it looks like there's you said there's less hospitalizations, which means that there's less people that seem to have severe enough symptoms to be hospitalized for the
Yeah.
disease, and also the danger. Um, See, more young people getting the disease, although they're less at risk of dying, they're actually a lot more dangerous because they might be more likely to forego wearing a mask because they feel fine. And so they might not
Right.
suspect they have a disease, and then they might spread it to people who will get more sick from the disease.
I know. I mean, we gotta tell them to wear a mask. We gotta tell them to rein it in. I mean, they're gonna do what they want to do to some extent, but at least, yeah, wear the mask if you're gonna be out of the house. Um, we're not. I think most of those folks are smart enough to know that if they get positive, test positive, they'll stay home because it is a high. Even it is a highly contagious thing. Uh, and certainly wear a mask if they don't. But even once they get over it, keep wearing masks, and everybody keep wearing masks. It's the best way to prevent the spread. But so those young people don't want to hear it. I know you're young, but you're smart. Some of these guys just don't want to hear it and don't care. But we gotta be vigilant about it and persistent.
Right. Now, um, because hospitals have kind of a bit of a better grasp on COVID-19, is normal hospital activities returning a bit with a bit more force?
Well, regular hospital rules. I mean, they're allowing outpatient procedures. Hospitals do procedures on an outpatient basis, and those are ramping up or have been ramping up for a while, and may not be at levels they were before COVID back earlier this year, but they're ramping up. Those are, patients from the outside go to the hospital for their procedure and go home that same day. That's a big stream of revenue for the hospital. So that couldn't stay down too long. So the hospital that's been open and ramping up for a bit, and that's almost back to normal levels. Um, and so the hospital operations are normal-ish levels too. The nursing staff at full force. Certain wings and wards are full, and not. And some folks who were originally afraid to come to the ER are coming back. So the ERs are getting busier. There are some other rules though the hospital has adopted since this. No family visitors in the rooms. Uh, Patients who are there for that elective hospital procedure, their transportation and rides home needs to stay in the car on the street or in a nearby parking lot. So where they're on call them for a pickup, they can't come up to the floor and be in the waiting room, for example. Um, and yeah, no visitors, and just the schedule is staggered a little bit just to avoid more person to person contact in terms of X-rays and other diagnostics within the hospital itself. So uh, that's the how it's different. But the census or the how many patients are in the hospital seem to be climbing and being okay.
All right, that's always a good note.
Yeah.
And of course, um, always hospitals are the ones at the full taking the full force of the pandemic. So of course, a hospital is going to uh, know all the tricks to uh, preventing spread of viruses and disease in general. And so I guess they're just, they're able to take uh, those proven strategies over the decades and use them all at once. And you end up with a hospital that's actually pretty clean.
Right.
And ventilation is something that we're starting to, in general, look at more often because of this disease. Even though ventilation
Yeah.
has always been something that is important.
Yeah,
Because
there's two ways to do that. There's the real thorough, expensive way where filters in its essential system, and maybe that's where we're headed with all eventually. Until then, you can do some local, bring your own filter system, fan and filter system, and put it in the corner of the room or to the side of the room. Some of the hospital floors have demonstrated that already. You can do it in your office, you can do it in your house, and that can be helpful if you have uh, a lot of foot traffic going through a spot. Basically your office where there's a lot of foot traffic going on. You can clear the air. We're headed toward more central forms of that, central filtration systems in the air ducts above you in the ceiling space and all that. But until then, the air filtration industry is seen a lot busier time. Is getting real busy right now.
Exactly. Yeah. Even and it sometimes it might be hard for at least me personally when I'm in a room that is being ventilated a lot. You don't always actually feel it. Like you don't always feel because like obviously with a fan blowing at your face, you feel that force, and a fan blowing away from your face, you can feel a little bit. Um, so how many? I guess what I'm getting to is how many times is a typical indoor space in a hospital filtered? Or I guess it depends.
Yeah, it depends. I mean, there's the ICUs and some special rooms are built for it, but the regular floors not so much. That's where those temporary filters are coming through. The ICU it has the central filtering system,
Yeah.
and there's certain rooms on the floor called negative pressure rooms that are constantly
Oh.
filtered. Certain infectious patients occupy those rooms, tuberculosis patients, and
Oh.
maybe a COVID patient. Things like that where there's it's filtered instantly through the duct in that room and purified. Not every room is like that. Not every hallway is like that. So certain areas of the hospital have that constantly, depending on the type of patient running through there. And then there's the regular floor, which doesn't have that, and that's where But in normal times, you didn't really need central in that, because it's just regular hospitalization stuff. But now with COVID floating, who knows where they'll start to some filtration systems more, and may revamp the whole hospital filtration system to where you get centralized filtration and more thorough clearing out of any particles or bacteria. We talked about this in an earlier show that you want it below, you want it to filter out 0.003 microns, which
Exactly.
is
Those are
won't get the
HGPA
viruses
filters.
number.
Right.
Yeah,
Right. HGPA
exactly.
filters. And right,
Yeah.
because viruses, at least the COVID-19 viruses, travel. Actually, yeah, I'll just ask that question. Do all viruses travel on water droplets when they're
Um,
air viruses?
no, not all. Not all are transmitted through the droplets. The respiratory and this family is, but there are certain viruses that are not. Certain family, the zoster family, the shingles and the chickenpox family and the herpes family are not that way, or the HIV is not that way. But the corona and the cold and flu and perhaps some GI viruses are. So but and those are the ones that you want to get. The other viruses that aren't transmitted that way, purifiers aren't going to do you any good. It's just got to refrain from transmitting them. Close contact and and you know, uh, just primary contact. So it's not necessarily a
Yeah,
filtration issue.
exactly. And in those cases where, I mean, these filters, of course, in order for them to work against viruses like COVID-19, they have to filter out the water. So I guess, does that mean the air gets particularly dry? And like, does it get dry enough to where the hospital considers putting fresh water back in?
I don't. We won't try the air to that extent, um, but in general, a humidifier or to reinsert the water in the air is not a bad thing to have in a hospital in certain patient circumstances. But even a big super industrial filter is not going to dry out the air to a point where
Okay,
it's hazardous or you need to make an adjustment.
right. In fact, can air get dry enough to be hazardous?
Not hazardous, no. It can be annoying,
Right. Yeah.
and comfortable, and you're drying out your nose and your mouth, and it's annoying, but it's not gonna it's not gonna
Right.
be a reason why you catch any virus or get sick or whatever.
All right. Yeah. So it's not exactly a large concern anyway.
Right. You just
We
need to
have a
get rid of the
question.
virus. Whatever water gets taken away, so be it. But the virus is the number one priority.
Exactly. We have a question from the chat. Do you
Oh,
think
very
it may get to a point where we have rapid COVID testing and people have to be tested in order to enter a hospital?
Yeah, we're headed to an accurate, rapid test, um, where life will sort of return to a little bit more normalcy when these rapid tests are available. Yes, if you want to, go to the hospital, if you want to go to visit someone in a nursing home or in a facility like that. I don't know if you want to if there's a to fill a movie theater maybe before going in there, where there's a large crowd, close shoulder to shoulder. You'll do something like that to get through there. That may be where we're headed until there's plenty of treatment and a very effective vaccine that becomes old hat. The rapid testing is going to be our ticket to doing the things we like to do again, as opposed to staying bolted behind our locked door at home.
Right. So especially since rapid testing, it needs to be very accurate, but it also needs to be cheap so that it can be given out to more than just hospitals, to, like you said, nursing homes.
Yeah.
And people can visit their loved ones easier. Things will just
it's
get
gotta be
great.
cheap. All this stuff's got to be cheap. And one day, and it will be, may not be super cheap at first, but it will be cheap enough one day as we, progress and adapt and so on. HIV was crazy at first. Now it's nothing. I know it was 35 years ago, but, we don't really want to wait 35 years. But
Right.
medicine evolves and tests are created and things get controlled, and this is going to be one of those too.
Exactly. Now, I would like to kind of talk a little bit more about masks to the people of the chat, because to our viewers, because a couple times I've seen someone, well, not one person, but multiple times I've seen people say how masks aren't effective because viruses are like too tiny. And what's of course important to understand here is that these viruses can only travel on water. And the water that it travels on, the water droplets, are much, much larger than the virus, and those water droplets can get caught by the mask.
Yeah, the mask is catching some of the virus. The mask is not catching all of the virus.
That too.
Okay, so what's key to understand is the main reason for the mask is even when you're breathing or speaking, some will get caught, but what's not caught is just you know in a small radius around you, far enough away from other people that they're not going to catch it. Without a mask, the virus that's expelled extends out to where people are
Exactly.
within reach, and they can get it with the mask. The mask, yeah, it's not catching the virus, so the virus is getting through the mask, but it's only going this far away as opposed to this far away,
Exactly.
and that's the difference. So
In
even
fact,
if you're
it's
not
kind of like a
catching the virus,
parachute.
yeah, it's like slowing it down. You're like grabbing it by the you're trying to run away and you're grabbing it by the back of the guy's shirt. He can't really get very far, as opposed to letting go and then he's gonna be far away real fast. That's what the mask does. So it's not designed to trap things. So you're not breathing back in virus. It's trapping your secretions and it's limiting how far your secretions are being expelled, which are within your own personal space where nobody is close enough to catch it. That's how we keep the virus from spreading.
Exactly.
Hopefully, yeah.
That's why they say to social distance and wear a mask, because the mask prevents the virus particles from traveling 6 feet far, at least a
Yeah,
significant portion of them.
right. And then you
Uh,
can stay 6 feet away and have that extra protection there.
and of course, masks of course can't be, especially the surgical mask, can't be exactly perfect. But of course, that's no excuse to not wear a mask. I mean, 99% prevention is better than 0% prevention. It's not an all or nothing matter.
Yeah, right. If you expect to be around people or encountering people, you have to wear a mask. It will help you. I do believe now, and I believe this all along, that a mask is protective. The N95s, we know, are protective against the wearer, but even the surgical masks are protective against the person wearing it. It's more protective against others, but it's also protective against your own self. And standing 6 feet away and wearing a mask, you know, is excellent protection. That's what I've been doing. I've been back to work. We have patients at distance in the office. Um, we've been following all the social distance guidelines with mask wearing and distancing. And knock on wood, it's been almost 4 months of being working here with this COVID, and
Yeah.
obviously I'm okay. So
We have a question from the chat. Are masks worn below the nose effective? How much of virus is breathed out of the nose?
a lot. So the nose has to be covered. The mouth is more speaking. The nose, you're breathing through your nose. A mask that doesn't cover your nose, I mean, what, you got to cover the nose. So it's not worth wearing a mask without covering the nose. You got to cover the mouth and the nose and go below the chin, kind of like that. You
Yes.
see, and that is the way to wear it.
Yep.
The nose is still, without the mask, the air is getting further away. Now it's not speaking super far, but it's getting further away. Then within the mask, it's not very far at all. So you got to cover that nose, because that's where they test for the COVID. Is virus is up your nose. If it's going to be up anywhere, it's going to be up your nose.
Exactly. Yeah. The nose has a lot of protections against viruses anyway, which also means that viruses can get caught in there. Okay, I don't know the specifics of how a disease travels through your nose and through your sinuses. But because the nose has a lot of water in it, I mean, your inside your body always has a lot of water everywhere.
Yeah.
But your nose has a lot of mucus. It has the mucous membranes. So it's just
So
another place.
like to hang out there, and you breathe in, and it gets further back, and you breathe in again, and it gets further back, and then it gets into your lungs. So it's
Exactly.
it's the gateway to your lungs up there, and it'll get down there because you keep inhaling, and it inhales and it inhales, and it goes and goes and goes. It gets to your lung, and it gets to your bloodstream from the nose, and it gets to the bloodstream into the lungs too.
Exactly. And one thing to remember too is that you're protecting yourself by wearing a mask properly too. If you happen to not be very convinced about protecting others, you are protecting yourself by wearing a mask. So for anyone who knows somebody who needs more convincing, there's some more words to maybe help get them to practice public safety. Yes.
Yeah, it's a public. You're doing yourself a favor. So obviously, you would like to protect yourself, and more importantly, other folks there who you don't know their underlying medical history. People in line at the, walking past you outside or wherever you may be going. You don't know what their underlying pre-existing conditions may be.
Exactly.
So wear the mask.
You could be walking by a cancer patient. You could be walking by an immunosuppressed person.
Yeah.
You just don't know who you're next to, and anywhere. And so it's important to be cautious for that reason, because you don't know when you could be up against somebody who could get seriously ill from a disease that you may have.
Yeah, exactly. So you just got to be considerate, and it's not a political thing. It's a health
No, it's
thing.
not.
Bottom line. I mean, we're trying to get that point across to everybody.
Right. And it's like, it's not really people, like some people like to talk of it as like a liberty thing. I mean, here's one example. Is murder legal? No,
No.
because that would be inhibiting on someone else's right to live.
Yes.
So even though you don't have like a right to do whatever you want by killing somebody, you're preventing their right to do whatever else they want. And masks are actually kind of a similar thing, because, well, viruses kill. Viruses have killed 201,000 Americans. I don't usually like to bring up the fact that they're Americans because it doesn't really matter, but some people, they do. Remember, many more hundreds of thousands of people have died around the world. And because of international travel, due to
Right.
airplanes,
$1 million in terms of from COVID, millions of people have died around the world.
exactly. We have a nice question from the chat. Is the thought that it transfers through aerosols or is touching face after touching something still a concern? So I think like touching a surface and touching your face.
Yeah, that's been flip-flopping. The aerosol thing, we know that's the way it's caught most of the time. Touching face and touching surfaces, it's controversial how much that is transmittable that way. My suggestion would be just, keep your hands clean. Wash your hands multiple times a day, more than multiple times a day. Have your hand sanitizer nearby, because you go ahead and touch what you got to touch, but keep your hands clean. And I know you touch your face a lot with a mask. You protect by touching your face, but more importantly, just keep your hands clean by washing them well, like we just demonstrated in an earlier show, or hand sanitizer. So I think the surfaces thing, not as much of a thing, but regardless, just keep your hands clean, and then the surface thing is not an issue, even if it's a
Exactly.
wave spinning or not. You make it null and void by keeping your hands clean. I wash my hands. I lose track. I wash, I mean, I'm a doctor, of course, but even if not, I even when I'm home on the weekends, I'll get up in the middle of watching TV and wash my hands, or I bring in my newspaper, I wash my hands. I, put away laundry, I wash my hand. Whatever. I mean, you just keep washing your hands, and then
Exactly.
the surface thing is not a thing. It's controversial. I would just not have to think about it by washing your hands all day long.
Exactly. Yeah. And washing your hands prevents disease. Not just COVID-19, but just all diseases.
Yeah. So if there's something on a surface, wash your hands. If you touch a cardboard box from Amazon, wash your hands. Just do it, and then you don't have to worry about the surfaces and the whole face touching thing.
And before we wrap up hand washing and the show, I think we should go into a little bit of detail on how to properly hand wash, because I feel like that hand washing is a little bit of a paying attention to detail, because you have to make sure that you're touching spots and rubbing spots that, well, you haven't rubbed yet. So let's see. Can we do a demonstration?
Yeah, I'll do the demonstration again. So you get plenty of soap. It's the soap and the suds that work very well. You want to do a lukewarm water and get the soap all sudsy on your hands. I'll stand up so you can see my hands a little bit better. But you'll you just kind of do your normal hand washing around like this for a few minutes. Then the key thing is to take one hand over the other and scrub between the fingers and scrub the back of your hand like that. Right hand over left for a few seconds. Switch it up and left hand over right for a few seconds like that. Okay. Then you got to get the tips of your fingers and like kind of under the fingernails. So you want to do like a gripping like this and like do this for a few seconds like that. So this is while singing like the Star Spangled Banner or something. Like a 2 minute kind of exercise. Then you want to get your thumbs real well and the webbing between the fingers and the thumbs here on both hands. So then you switch that way, and you want to also get like high up on to the wrist area. You just don't want to stop. You want to go. So you got to get back here. You want to get back here a little bit. You can do that with this motion before. So you got the hand washing, the top of this, a little bit of this, and then the thumb ways, and then you're rinsing off one at a time. And it's best to have the paper towel ready and then turn off the water, because you turned on the water with sort of a dirty hand. So you use your drying towel to touch the faucet and turn it off, then dry your hands and you're good. So that motion over like this is key. Getting the back of the hand here and on the other side by doing this is important, because you're gonna inadvertently touch your face with the back of your hand as much as you will with the front. You don't realize it, but it does, and that will, when you touch face, if you wash your hands the right way, you won't have to worry about transmitting anything that may be on any surface.
Exactly. All right. Well, I think that was a great demonstration. Is there anything else that you would like to bring up before we end the show?
No, just want to, we talk about how hospitals have changed, outpatient or medical facilities have changed. I would just urge the patients out there to be patient, and we're all trying to learn how to function as efficiently as possible in the COVID times, and things may not be super smooth at times. You may have to wait for some services at times, or there may be some miscommunications and things. But we're all doing our best, and we just urge patience and a little good wishes, and everything's going to be okay. We have the patient's health always at the forefront, top-notch patient care. So I just urge a little patience and understanding, basically. And everybody's been pretty good in doing so. I would encourage everybody to continue with that.
Mm-hmm. Yes. We're making some good progress on the pandemic. If we keep things slow, then we're going to see a lot less damage to people and potentially our loved ones or yourself, if we just followed the procedures like wearing a mask and hand washing.
Yeah.
It's simple, but it works, and it works only if everybody does it, because the few weak links are going to mess up the state of the air, and of everybody else. If you would like to make a private appointment with Dr. Sherman, he's in the LA area, feel free to email towergastro@gmail.com. That link is in the chat. Or you can call his office at the phone number that is also in the chat. If you have a question for us that we couldn't get to during the show, then you may email us at myworldsciencetv@gmail.com. And we do these every Thursday just after 3 p.m. So until next time, be safe.